Hi friends, we know acne is a very common problem which affects adolescent age group and sometimes it can also affect adults. The most important sequelae of acne is scarring. It leads to severe scarring and disfigurement of face in many patients. So many of you who might have had acne, they might be having acne scars, and many of you might have tried different treatments for many years but to no respite. So in this video I'm gonna talk about the science behind acne scars and its treatments and its limitations, the success rate and results. I'm your friend Dr. Shaiil and I am a dermatologist with almost 20 years of experience. So, when there is inflammation in acne, there is pus formation, and which heals with scars. So, people who have nodulocystic acne or severe pustular acne, they can have more scarring. Sometimes there is, individual to individual variation also, genetic predisposition towards scarring. Patients have less severe acne, but they can have more scarring. So once scars are formed, you must realize the difference between scars and spots. So spots are is just discoloration of skin. There is no depth involved. While in scars there is involvement of depth. Okay, so the pigmentation, that means the spots, discoloration, usually responds well to a medical treatment. Sometimes we do peels also for that. But when you have scars, depth involvement, it will need some kind of intervention. Okay, so we are going to talk about this. Before that, we should know what kind of scars are there, what types of scars are there. So one of the commonest type of scars is ice pick scars. These scars are deep, very narrow, and they are like quite deep, like ice pick. So there is another type of scar called rolling scar. Rolling scar is a broad scar, much broader than this ice pick scar, and this scar has sloping edges. Okay. Now there is another variant called Boxcar scars. They are broad, but the edges are punched out, sharp edges, not sloping edges. So they are like even more visible, okay, as compared to the sloping edges uh, rolling scars. Then there is another variant called atrophic scar. These scars have like kind of thin skin, very fragile, atrophic skin. Then there is another variant called hypertrophic or keloidal scar. Now they are thicker scars with hypertrophy of skin. The skin, it appears like a bulge. You can have itching in these. They are very commonly seen in truncal acne, patients who have acne on the chest, especially the sternal area, and at the back also we see these scars. They can be also seen on the face. So people who have nodulocystic acne, in those patients it is commonly seen, or people who have predisposition towards hypertrophic scars or keloids, they can also have this. Then how to treat once these scars are formed? Have you tried treatments for this, different treatments, and did you find those treatments not exactly working out for you? So the reason is because you have different types of scars. One patient may have all these types of scars or some types of scars, and if we give one treatment, one solution for all of them, obviously that's not gonna work. But that's what happens when patients go to franchisee clinics, parlor based clinics, where they just hire doctor for some time and get the things done. So that is not the way to do it. The if you go to an experienced dermatologist who has good surgical skills, then only you will get the correct solution for this one. So the basic science behind treating these scars is collagen induction treatments. So as we know, if we get an injury, the injury heals and that gap is filled by new tissues. Now we have some gaps because of in the form of scars, and we want to fill them up with new tissues. But new tissues are not gonna come uh, at their own. So we need to induce that mobilization, and that mobilization of new tissues in that area is induced by some kind of trauma. So that trauma can be physical, chemical, it can be laser. So there are different types of traumas which you can give. So like in chemical peels we give chemical injury, we can give mechanical injury in form of derma rollers, in form of MNRF, or we can give laser injury in form of fractional laser. So there are different types of treatments, collagen induction treatments. So the basic idea is we give controlled injury with these treatments, and the skin heals without any scarring because the injury is controlled. So you have a downtime of around 2-3 days, sometimes even more, little less in some types of treatments, and the skin becomes a little red. You can have dots, small dots for some time, which may be there for 5-6 days if we are doing fractional laser. So all these treatments really help by inducing new collagen in the skin, and by inducing new collagen we also take care of some pigment. If it is there, we can get glow, tightness, firming. Basically all these treatments are done in anti-aging as well. So you get the treatment of scars, acne scars, and you get the treatment of anti-aging treatment for free, or you can say glow treatment for free. Now there are some other treatment options also. These are surgical treatments like subcision, where we know these scars have a fibrous band which is like kind of pulling them down. So we put a needle after numbing the area and break those bands. So you can have a little swelling, sometimes you can have a small bruise as well, but this goes away, and when these bands are reformed, they are not as strong as they used to be. So the surface of that scar, the depth of that scar is reduced in one session significantly. Another technique is one technique which is very good is like PRP. I usually combine these treatments, and obviously not one single treatment is going to work. Then there is another technique called punch float. This is wonderful. We can use small punches and cut the punches and cut the base and just leave those punch float skin tissues float over the skin, and it reduces the depth of skin significantly. Sometimes patients need multiple sessions of this treatment depending upon the severity of scars. You can see the results we got in severe scarring. Now these were the patients who were getting themselves treated for years, for decades, some of them, and they were obviously, they had tried a lot of treatments, different clinics, but it in no vain. So now you see the changes. So they wasted a lot of money, time and energy because they were not aware of the actual procedures. So whatever somebody says, you follow it. So these treatments are good when done in trained hands. And then there is another treatment called TCA cross. That is also a good treatment. I use it for ice pick scars. It helps. So it is a combination, and the timing at which you introduce the treatment, the sequence of treatments also matters a lot. Sometimes we use them combined. Sometimes I combine 3, 4, 5 treatments in one shot so that we can get the best with minimal downtime. Suppose if somebody is living in some other city and he or she has to travel, so this combination procedure really works well, and they don't have to come again and again. In a single session we can achieve a good reduction in the depth of the scars. So if you are looking for a treatment for your acne scars, I think this information would have helped you. and you can choose the treatments now, and obviously you can consult the doctor with more knowledge. If you want to get your assessment done or your treatment done by at Satya Clinic, then obviously you can write to us, you can share your pictures, our team of experts will help you. And if you have any questions, please ask in the comment section. Also you can ask. If you want me to make some other videos on some other topics, do write, I'll help. And then you can follow us on Instagram also. We keep on posting these procedure videos, live procedure videos, results, a lot of stuff there. And if you haven't subscribed the channel, please subscribe, and don't forget to press bell icon to receive all the notification. Take care of yourself. Thank you. Bye bye.